Ladies and gentlemen, the webinar is beginning. Welcome. My name is Chris Wilson. I'm the Communications Director here at the Dallas-Fort Worth Hospital Council. Normally, my President CEO, Steve Love, would be doing the hosting duties today. Unfortunately, he was called to a serious meeting with one of our hospital systems, and he sends his apologies. But thank you for being here today for this webinar hosted in coordination with FORVIS, an associate member of the Council. Today's topic is Market Perspective Pursuit of the Value-Centric Enterprise. This should be a great discussion. COVID-19 dramatically paused the market's transition to value as the global health crisis took precedence. While the pandemic underscored the need for value-based care, it also exposed the challenges of addressing the social determinants of health and inequities of care in underserved populations. And, the time has come to return our attention to value-based care transformation. Today, our speaker will take you through our healthcare market point of view to clearly define value, redefine care delivery models, and lead the next phase of innovation. Today's speaker is Craig Tolbert, Principal National Practice Leader, Healthcare Strategy and Finance at FORVIS. And I believe he's coming to us today by way of Birmingham, Alabama. We've worked with FORVIS now for many years, and they're valued friends of the Hospital Council. We have a terrific turnout today, and we are looking forward to Craig's presentation. Before we begin, I'd like to note we will be taking your questions. If you could type them in the question box, we'll answer them before the end of the presentation. And with that, ladies and gentlemen, here's Craig Tolbert.
Thanks, Chris, and good afternoon, everybody. Hope everybody is doing well. And as Chris mentioned, yes, I'm based out of our Birmingham, Alabama office. I am focused on our strategy and finance practices, and in particular have been working in our value-based care space for probably about the past 7 or 8 years. But I've been in healthcare, in the healthcare industry for almost 30 years, and have a passion, of course, in healthcare. So look forward to talking with you a little bit today about our perspective. And again, I guess just to give a preview of this is just a market perspective of kind of where we think value-based care is going, maybe where it is today, where it will be in the future. We know that all markets are not the same. Here in Alabama, we have markets that are not ready to kind of move more aggressively into value-based care. And I'm sure there in Dallas and Texas, you've got the same. We work with several clients there around the Dallas-Fort Worth area, and I know you're in different kind of cycles as far as how much you're taking on fee-for-service revenue versus value-based care. So understanding that, know that this is not a fit-all, fits every situation that you have, but hopefully it'll give you some information around where we think from a national trend things are going. And we kind of introduced kind of our perspective around risk capability back in 2013. And it was our belief at that time that, we needed to move more towards risk and value and outcomes and away from the status quo of fee-for-service revenue. Our perspective centered on the tipping point of market criteria and some of the first steps associated with the execution in a risk-based environment was your revenue transformation, your clinical transformation. What does that clinical enterprise maturity look like? What does the overall enterprise intelligence telling us? So what's the market telling us? And so those were some of the distinct and challenging topics that we kind of uncovered in 2013. But we feel like that today, we're going to have to be bolder in returning our attention to value-based care transformation. We're all, kind of coming out of the public health emergency. Now that that's expired, we've got near-term challenges that are accompanying the emergence from the pandemic. We can no longer kind of serve as the rationale for delaying the pursuit of value. Our employers, our patients, they're taking accountability and serving as a change catalyst. CMS and commercial payers are altering business models. They're redefining expectations of us, creating meaningful economic incentives, and providers must clearly define, that value equation. We've got to redefine care delivery models. we've got to develop or expand our competencies. And so that's where we've kind of created this value-centric enterprise definition. So we're going to kind of get into that now and talk a little bit about what that means. So here you can see the agenda. We're going to talk a little bit about the evolution of the value-based care and what that means, and some information shared from some other industry experts. And then we're going to dive into this pursuit of value and really talk about what we're defining the capabilities. What are the core capabilities organizations need to have in order to have a value-centric enterprise? And then what are the essential functions that go across your enterprise in order to have that value-centric enterprise? And then we'll wrap up with maybe some topics around positioning us for future success, and then kind of a call to action that we'll have for kind of turning into that value-centric enterprise. So just kind of talking about some of the information around where value-based care is moving and going. Towards the end of last year, CMS Innovation Center had a strategy refresh session with several advisors, and just kind of preparing for how to kind of renew their vision as they enter the second decade of value-based care, looking at alternative payments. And in the last decade, the CMS Innovation Centers launched over 50 different models. From 2018 to 2021, the Innovation Center has thrown out some statistics that they have reached over 30 million patients through their value-based care alternative payment model projects, and well over almost a million healthcare providers and plans. And so as of September of 2021, those models that have shown the most statistically significant savings, having included the Maryland all-payer model, the Pioneer ACO model, the Medicare Choices model, the value-based care for home health purchasing, and then of course the Medicare Shared Savings Program. So those are some of the top models that CMS has had success in, and all of those have been what we call shared savings type programs. And those programs are the types of models that we feel like are going to continue kind of in the future. Those are the ones that we continue to hear CMS throwing out different regulations and preliminary rules around, and for us to factor in. So you can see here on the slide here that one thing that they also said in their strategy refresh is they wanted to have all Medicare beneficiaries with parts A and B to have some type of care relationship around quality and total cost of care by 2030. So you're going to see several statistics that we're going to kind of show around that and what that means, for organizations kind of planning here in the future. One of those kind of think tanks that we like to kind of refer to is an organization called the Healthcare Payment Learning and Action Network, or HCP LAN. They were created back in 2015, and it's an active group of public and private health care leaders dedicated to providing thought leadership, strategic direction, and ongoing support to accelerate our care systems adoption of alternative payment models. So you can see here, they've revised their goal statement as of the end of last year, and kind of have adjusted some of their targets. And so in the chart here, these are kind of the targets that they're going to have or that they're pushing to have in the industry. And again, this is their goal to try to accelerate the percentage of U.S. healthcare payments tied to quality and value through the adoption of two-sided risk models. So that's with the Medicaid, you can see there in the green. In 24, they want 25% of those payments flowing through a two-sided kind of risk model, and then by 2030, 50%. And then there on the far right hand, the purple area, you can see the traditional Medicare going from 50% to 100% by 2030. So HCP LAN, every year they kind of assess where the U.S. is in terms of their healthcare payments that are tied to quality and value. And as of the end of 2022, that percentage is around 43%. So 43% of traditional Medicare beneficiaries are in some type of alternative payment model that has two-sided risk to both sides. So on the next slide, there we go. So on the next slide, we're going to talk a little bit about what we mean from a pursuit of value. You can see in the top left-hand corner, we've got a quote from the former Secretary of Health and Human Services, Alex Azar. And this was back in March of 18. And he was saying that basically, simply put, I don't intend to spend the next several years tinkering with how to build the very best joint replacement bundle, but we want to look at bold measures that will fundamentally reorient how Medicare and Medicaid pay for the care and create a true competitive playing field where value is rewarded handsomely. And so you can see we've kind of highlighted the pursuit of value, this pre-COVID area. And I talked a little bit about the risk capability and how we kind of described what risk capability is back in 2013 and 2014. But basically, you know, this is just kind of showing how that the CMS pilot programs started increasing back in 14 all the way up to 2018 to 2019. We had some early momentum, you know, built around the sustainable factors that are associated with the risk capability areas. And then we hit COVID. And so that really started declining any kind of progression around adopting value-based care measures. You can see here on the right-hand or left-hand side, we've got some statistics here. Back in late 2022, FORVIS did a what we call a mindset survey. So we surveyed C-suite executives all across the country and asked them questions about the impact of the pandemic and how that was impacting them from not only a strategic planning standpoint, but also a value-based care strategic standpoint. And you can see here that basically 53% of those providers, the C-suite executives, said that they have paused their strategic initiatives during the pandemic, and that also has negatively impacted not only their value-based care planning, but it's also impacted their operating margins. Nothing, you know, that you're not aware of. The survey also, you know, showed that 49% say that they were starting to accelerate their strategic plans during COVID. Where you might be asking, why, you know, were they doing that? Well, we were having to look at new methods of seeing patients. We were having to adopt to telehealth. We were having to adopt to patients not coming into the hospital. Our surgery centers, you know, had declining volume, so we were having to redefine what we looked like from a strategic planning standpoint. So some organizations started increasing their strategic alignment, while others, you know, were kind of pausing. And then also we had 48% that said that their current organizational capabilities did not match their strategic needs. So looking at all this information, we also wanted to try to extrapolate this into another population. And so we started working with HFMA earlier this year in 2023 and doing a similar survey with their respondents. And the top 3 benefits of value-based care kind of arose that organizations felt like that value-based care allowed them to kind of take more of a system-wide approach to care management. The second top point that came up is that value-based care allowed them to address gaps in the continuum of care. And then the third benefit was the leverage of data and the technology in order to track that care. So as you can see on that pursuit of value slide, we started kind of coming out of the pandemic and what we call the reawakening period. You know, we started seeing more provider self-awareness, more external pressures, more financial restoration. But we also, you know, we're starting to see some of the issues that were impacting all of our organizations, you know, from coming out of the pandemic standpoint, where we had problems associated with labor shortages, skyrocketing expenses, capacity constraints, inflationary impact, you know, either from operating expenses, drugs, medical supplies, et cetera, and just disappearing margins in general. So coming out of the pandemic, this reawakening period kind of resulted in us kind of coming together thinking that, hey, now is the time that we've got to think about value in a different standpoint. And so that's where we created this white paper, this market point of view around value-centric enterprise. And so I'm going to dive into that here in just a little bit, kind of in more detail around, what we mean by that. And so the momentum that we had kind of in coming out of the pandemic kind of pushed us into creating this theme around value-centric enterprise. And this quote on the far right-hand side was from Jim Collins in his book, Good to Great, where basically he said that no matter how dramatic the end result, the good to great transformations never happened in one fell swoop. Rather, the process resembled relentlessly pushing a giant heavy flywheel in one direction, turn upon turn, building momentum until a point of breakthrough and beyond. And so we kind of use this theme of a flywheel and this quote to kind of help us describe how this value-centric enterprise should work. And so in doing that, we basically have tried to explain how that we know that we challenge providers to invest in these critical capabilities to sustain in the long run, while also optimizing the essential functions to support near-term operating realities. So again, this is our point of view in recognizing how we've got to push this flywheel concept, and it will take determination, courage to kind of reach that point of breakthrough and beyond. And so as we look at this flywheel, this is again FORVIS's kind of thinking around what that value-centric enterprise looks like. And so again, going back to when we talked about in 2013 and 2014 around risk capability and the ability to accept risk and orient organization strategy toward value, that's what we're trying to rejuvenate and try to get that thinking going again here in 2023. And so our market point of view focuses on that evolution of provider organizations moving toward this value-centric enterprise. And you can see in this flywheel on the very top side, we've got what we call critical capabilities. We've got strategic agility, we've got change clarity, financial sustainability, growth fluidity, value centricity. And then along the bottom of the flywheel are what we call our essential functions. So if not properly managed, they can cause the near-term sustainability challenges to hit those critical capabilities that we mentioned. And so those essential functions are around finance and reimbursement, clinical operations, and compliance. So now I'm going to dive a little bit deeper into each of our kind of clinical capabilities. And so first, we need to define what capability is. And so capabilities are the intangible assets that drive organizations forward, combining the competencies of their people to advance an organization's mission and drive results identified during strategic planning and also developed through investment, patience, and vision. So here in the middle, we've got four kind of examples of what capabilities of well-managed organizations kind of look like, which came from a white paper from Norm Smallwood and Dave Ulrich. So four of those are around talent. So how are we attracting and motivating and retaining competent and committed people? And then speed. How are we able to be good at making important decisions in a rapid manner? And then connectivity. How are we being good at building and enduring relationships of trust and targeted customers? And then innovation. How are we being creative in the ideas and the initiatives and solutions that we're trying to create? So as we dive a little bit deeper into those capabilities, we'll kind of open up each one of these 5 core capabilities, and we'll start with the growth fluidity. So under the growth fluidity, you can see the definition here of exploring unique strategic paths to sustainable growth. And so when we think about that, we're talking about driving long-term organizational performance and how it requires dedication to mission-aligned, profitable growth. In our mindset survey, we also found that nearly half of the health systems and executives that participated, they foresaw consolidation efforts in their market service areas within the next year, demonstrating the need to accelerate growth strategies. So with this growth fluidity, organizations can evaluate and mobilize growth initiatives around several key developments, including the ideal need to look at systems of care, to look at service line growth, financial affordability, and sustainability, and then also value-based initiatives. That second critical capability is strategic agility. And that strategic agility, the definition there you can see is around collaborating strategic direction as conditions demand. So now is the time to revisit strategic plans that maybe have been paused during the pandemic and look at reigniting what our core strategies are. It's also essential that in order to have an effective strategic plan, that we can't do that in a bubble. We've got to include other stakeholders in our strategic plan, whether it's our physician partners, whether it's our board members, whether it's members in the community, and also maybe partners. That could be a health plan, it could be another payer, it could be post-acute partners. So all of those entities need to help us in thinking about what that strategy should be for our organization. There in the middle is value centricity. So the definition of value centricity is around centering the organization on the pursuit of value. So I talked about the HCP land and how their focus has been actively working to create more two-sided risk alternative models in the public and private sectors. And these models hold providers accountable for the cost of services by requiring them to incur the excess cost in the industry. So you might be thinking, well, how do we look at value centricity? Maybe asking a couple of questions around how do we put the patient at the center of this value curve? How do we accelerate innovation? Or how do we help around accountability? So again, we expect two-sided payment models to continue to rise in the near term, driven by these market pressures brought on by the COVID-19 pandemic. So as we've seen in this type of centricity, organizations can successfully incorporate value into their planning and their operations and their finances. Next is the financial sustainability. And the definition there is around identifying and sustaining margin improvement. Here, we're thinking about how healthcare organizations are going to need to continue to face difficult decisions driven by margin pressures. We're seeing health systems continue to report eroding margins over the past year and into this year, and all of that's due to increased labor, increased supplies, and drug expenses. As we continue to progress through 2023 and into 2024, we're continuing to see providers and the operating margins continue to decline. Thus, driving sustainable financial future requires creativity, perseverance, as our industry looks to put healthcare organizations on a solid footing. And then finally, the last critical capability is around change clarity. And so what we mean by change clarity is taking the guesswork out of organizational change. Unfortunately, we are biologically wired to resist change. And this response, leads us to frustration, exhaustion, but from adapting to the social distancing and masking to adjusting to telemedicine and hybrid work environments, the change associated with the pandemic has driven us to unprecedented fatigue and burnout in our industry. And that's ever changing for the workforce that we're having to deal with. as the industry continues to point to these value-centric models, tomorrow's health system, looks remarkably different than today's. And in order to accurately diagnose this change fatigue and prescribing effective remedies will be essential in being successful in the future. So in order to kind of change clarity, organizations will rely on the portfolio of human capital diagnostics that paint a holistic picture of the state of their workforce. And with that clarity, leaders and managers will gain essential insight for successful transition into tomorrow's health system. So I wanted to next kind of transition into an example of how one of our clients kind of used these critical capabilities as a case study. Orlando Health acquired Sabanera Health, an acute hospital in Puerto Rico, and this acquisition was a crucial step in both organizations' goal of expanding relationships within the state of Florida and then maintaining a commitment to the territory of Puerto Rico. Due to the high number of patients that travel between the two communities, the acquisition will enhance quality and the continuity of care for all the patients. You can see here the opportunities are around driving medical tourism, improving care, enhancing synergies around almost 1 million of the Puerto Ricans that are in Florida. And this just, again, demonstrates the agility to pivot your strategic plan as opportunities present themselves. And it also looks at how we are flexible to follow growth opportunities, where they present. So again, just a kind of a case study example of taking those core kind of critical capabilities of our flywheel and putting into action. So next, we'll kind of move into what are the essential functions. And so when we think about the essential functions, functions are the systems and tasks and processes that make up a health organization's daily operations. That could be ranging from finance to strategy and clinical care to safety and compliance. And the intersection of these functions with patient experience forms these baseline expectations. And so, like the essential functions of a job, these functions are absolutely necessary and extremely important to the ongoing operations. And here we've kind of identified three around quality, safety, and care. And so now we're going to kind of dive in efficiency. And so now we're going to kind of dive into those three essential functions that we had listed kind of previously on the flywheel. So again, while the industry has changed forever, and as a provider organization has attempted to transform themselves in a value-centric enterprise, these sets of essential functions are going to serve as the supporting catalyst for a change or as a deterrent for organizations to stay status quo. So these three essential functions are around finance and reimbursement. So how do we manage in looking at the often overlooked strategy opportunities to drive performance? How does this management of the enterprise's financial resources and reimbursement look at maybe short-term needs or long-term objectives? And then the second one is around clinical operations. How do we handle day-to-day operational management of the functions and the facilities within our healthcare enterprise? And then finally, around compliance. What are the ongoing process of evaluating and meeting legal, statutory, ethical, and professional standards applicable to the enterprise? So again, all critical activities that we look as far as essential functions around that value-centric enterprise. And so next is kind of a case study around using these essential functions. And Nemours Children's Health out of Florida was one of the examples we wanted to talk about and raise here, where they looked at the opportunity to rebrand as a value and population health system. They looked at implementing operational initiatives to improve margins. They looked at how to reallocate investment funds. And all of this is demonstrating their alignment of strategic, operational, clinical, financial, and academic initiatives in order to support that value-centric vision. And then also this helped improve execution across critical capabilities and essential functions driven by this refreshed strategic plan that they did across their markets. So next, wanted to talk a little bit around transitioning from our pursuit of the value-centric enterprise to how are we going to use this market perspective to help position us for future success. So again, going back to some of the mindset surveys that we had, basically we had 89% of those surveys that took the survey believed that their organization needed to engage in more value-based care arrangements. And 48% were saying that their current organizational capabilities did not match their strategic needs. And then what were some of the emerging trends that were kind of coming out? We were hearing artificial intelligence, how AI has the potential to address some of the biggest concerns that health systems face, including rising costs, high inflation, clinician shortages, and physician burnout. Around health equity, what are the health inequities cost around the U.S. are around $320 billion a year today, and that could approach $1 trillion by 2040 if left unaddressed. The emerging trend around Medicare Advantage. Last year's growth alone increased the Medicare Advantage program by 9.5% and added close to 2.6 million beneficiaries that joined Medicare Advantage. And then finally, another emerging trend that came out of the survey was around how non-traditional players are coming into the healthcare industry. And what I mean by that is like Amazon and how that they have recently announced the purchase of One Medical in their primary care company, or CVS and how they have acquired Oak Health Street, another primary care company. So all of this to say is when we think about aligning and positioning ourselves for future success, you know, we not only have to look inside the four walls of our hospital, but we also have to look at health plans. We have to look at how we can compete with commercial contracts. How are we going to deal with Medicare Advantage contracts and the shift that we're seeing from Medicare to Medicare Advantage with a lot of our populations? And then how are we going to participate in these CMS and CMMI models that continue to get rolled out from year to year, and what's going to happen, you know, if these programs move into some type of mandatory status here in the future. So a lot of things that we've got to consider when we think about how we're going to position ourselves for future success when it comes to this value-centric enterprise. So as we think about that, you know, really it's time to, you know, make haste and not waste. So I put a couple of little bullet points here, but basically what we're saying is, you know, in order to stay financially viable, healthcare organizations must evaluate, operate, and successfully align across payment and care delivery work streams. The rapid growth and evolution of alternative payment models and bundle payment programs have hit a tipping point in healthcare, and there's an imperative to move towards value-based care with haste. So while essentially to promoting clinician efficiency and in order to drive improved patient outcomes and experience, enablers are notoriously challenging us to evaluate and implement. And you can see here, we've kind of listed a couple of those where, you know, what is our long-term alternative payment strategy? How are we going to enable our providers to participate in these different value-based care models to learn around these programs before they become mandatory? And then also, how do we optimize some of the resources that we have around the initiatives where, you know, we can benefit from using, put an example of CDI, we can use our clinical documentation integrity initiatives, not only for fee-for-service, but also how do we use those in value-based care and with some of the value-based care contracts that we have in the Medicare managed care arenas as well. So all of that to say is that we've got different strategic considerations that we've got to make. We've got to think about the timing. When do we jump out of our fee-for-service boat into a value-based care? How do we balance that? Looking at the volume, knowing that sometimes the volume of contracts with value-based care components maybe not be as lucrative. How do we look at governance and oversight of a value-based care organization? Where does that fit within our governance structure? Are there things we need to build versus buy? Do we need to look at partners in the post-acute world to help us kind of grow our value-based care infrastructure around the full continuum that we're looking at? Clinically integrated networks, that's another area to look into that we're seeing a continued growth in health systems, not only from a health system perspective, but from a region and from a state perspective, where different hospitals are coming together, forming a regionally clinical integrated network. Some are looking at statewide clinical integrated networks of how they can combine resources and use that to better contract around these value-based care contracts. Physician alignment, you can use value-based care as a way to align with your physicians on different types of contracts and arrangements. And then change management and culture, definitely something that you've got to consider coming out of the pandemic, and what kind of changes that are already occurring and how that's going to impact your culture. And then probably one of the most important considerations is data analytics and capabilities around what your current organization looks like, how you're able to handle these large volumes of claim files that are coming from the payers and the different value-based contracts that you've got, making sure you've got the right kind of capabilities to be able to evaluate your performance in these value-based care programs. So one might ask, well, how do I get started? Here are a couple of boxes around maybe some best practices around getting started. First is assess your organization's capabilities and appetite to move into value-based arrangements. How do I dip a toe, per se, into a particular contract or a type of model that would allow our organization to start developing some of these capabilities? Or how do I redefine our vision and our goals for value-based care delivery? How do we align the right resources and the right people to make sure that we are driving value-based care across our organization and into our community? How do we evaluate value-based care arrangements that offer a glide path towards downside risk? So again, CMS has created several different programs that are one-sided models, that you can stay in those one-sided models for a couple of years and learn and grow and add resources as you can, and then move towards more of a two-sided risk model once you're ready and you've built up the strength and those muscles and those resources that you need to compete in those two-sided risk models. And then finally, making sure that we're evolving our governance structure to support value-based care initiatives, creating a structure that allows you to evaluate the return on investment of getting into these models, or looking at resources that we're going to use for these value-based care initiatives. So a lot of things to kind of consider when thinking about, what do we need to do as far as how to get started. And so finally, these are kind of three stages that we see, different organizations in when related to their execution of a value-based care program or model. First, we see some organizations in this planning phase where, they're looking to adopt value-based care strategies or secure value-based contracts. So again, just kind of getting started, dipping their toe in the water, per se. Others are in this phase too, where they're implementing, basically they've already adopted some value-based care strategies, but now they're in the early stage of implementing, looking at developing preferred post-acute networks, looking at arrangements with their physicians and helping to contract with them to grow that value-based care population and to better manage that value-based care population from a quality and cost perspective. And then phase three, some organizations are really experienced in this value-based care world, and so they're moving, existing strategies and contracts where they're, maybe moving more from a heavier fee-for-service model to more of a heavier value-based care model, more of their contracts have shared savings components or some type of episodic bundle payment associated with those strategies. So a lot of things, kind of occurring in different phases that you could be in as far as executing your value-based care strategy. So what are some critical success factors associated with thinking about getting into value-based care, thinking about this value-centric enterprise? So again, we feel like that organizations need to have a clear vision for a future state of population health. Now is the time to start, focusing on population health, making sure that you are looking at alternative payment models and ways to be more creative, looking at network creation, how you can partner maybe with other health systems that are more advanced in population health. Even some payers are offering resources to partner with them around value-based care initiatives. Making sure we clearly define roles and responsibilities, that we've got executive buy-in, from the C-suite to the executives and physicians to your board, as far as the buy-in of what your strategy is around value-based care. The accountability for population health strategy and execution around contract performance, operations, network development, and growth. So again, making sure you've got the right kind of tools and processes to be able to monitor, do we have a return on investment? Do we have the right mechanism to evaluate when we need to grow and add more physicians or more providers, or look at a new contract, making sure we've got that kind of right accountability within our organization. Consolidation of population health programs, looking at team structures. One example here is around care management and how we can use those care management resources, not only on the inpatient side, but also the outpatient side when we're thinking about managing value-based care initiatives, and using those care management resources kind of back and forth so that way a patient doesn't have touch points from 3 different care managers because they're in 3 different kind of buckets across our organizational structure. So, really looking at how we streamline the structure and governance structure of some of our programs and departments within the hospital. So in summary, we've talked a lot about kind of the shift of value-based care and how it's not slowing down. We're seeing the announcement of mandatory bundles that CMS is kind of throwing out there that might start in 2026. So again, we feel like that this strategic direction of value-based care is not slowing down. Medicare has made known that they want 100% of their beneficiaries in some kind of a program by 2030 that monitors quality and cost. We also know that the structure of these financial arrangements and levels of risk, do create exposure and contract performance, and we've got to, make sure that we're balancing our portfolios between fee-for-service and value-based care. Again, with how margins are decreasing and it's more and more difficult. So, again, as we think about that flywheel and how that we are talking about the pursuit of this value-centric enterprise, just reminding you that we've got those 5 different core critical capabilities that we're looking at, those 3 essential functions. And, this study, this point of view, again, is just kind of recommending how leaders have to study their market carefully. As I mentioned at the very, top of the hour, is that every market is unique. Some markets are more progressed and they're, more evolved into looking at value-based care and going towards those value contracts versus others. So how do we evaluate that and create kind of a clear picture of what that value-centric enterprise looks like for our market? And then making sure we've got a clear understanding of the investment for these defined critical capabilities, and how we use and optimize these essential functions that we've kind of listed out, so that we can generate the momentum and the the excitement and the energy that we need to move forward in this transformation of building a value-centric enterprise. So, we feel like that now's the time to be bold, take this action, meet the needs of our local communities, our broader markets, the industry as a whole, whether it's in the near or long-term or distant future. So a couple of kind of call to action steps here. Again, when you're thinking about building a value-centric enterprise, it takes conviction. So moving past the post-pandemic challenges and refocusing on strategic initiatives and investments, will help us prepare for a successful journey and a sustainable long-term future to better care for our communities that we serve. So the time is now. We've got to build that momentum. And then we also need to look at beginning to push this flywheel concept that we've talked about around this pursuit of the value-centric enterprise. And then finally, follow the playbook, look at that strategy, make sure you're creating a strategic plan, helping you create what that plan looks like to create that value-centric enterprise. All right, Chris, so with that, I'm going to stop sharing and see if we've got any questions.
Sure, and thank you, Craig. What a great quality presentation. And I've been working with FORVIS now for a couple of years, and I'm always impressed by their level of expertise. And I want to tell our attendees, go ahead and type in your questions now, because this is a great opportunity. Take advantage of it. And I do have a question here. How can healthcare staffing companies partner with organizations to help drive value-based care?
Yeah, I think that's a good question. And, definitely is one where, you've got resources from a care management perspective. That's probably one of the biggest opportunities that I can think of when you've got a decline in care managers, and how you can look at those staffing needs and use that flexibility of, as your population in this value-based care contract increases, you can use those staffing models to be able to pull in those care managers to help you in these value-based care contracts. So definitely a strategy that you could look at if you're not looking at wanting to grow and employ your own internal team, looking at a staffing approach to use from a value-based care standpoint.
Okay, we got another question here. What are the key infrastructure investments needed to take on APMs? How long does it take to develop capabilities?
Wow, that's a loaded question there. So it is an investment period, and just depending on how large your health system is, you've got to look at the infrastructure cost, which first would be kind of leadership. Do you have the right type of executive senior leader that has that value-based care experience that can help guide you into this value-based care and looking at alternative payment models? Next, you've got to look at technology. Do you have the right type of EMR systems? Do you have the right type of data analytic capabilities to look at the data sets and the ability to be able to monitor the performance in these alternative payment models? There are organizations out there that do outsource, some of those services, so that you can build those skill sets up. And so when I mean like a loaded question, you've got different approaches that you can take to get into alternative payment models. Like I said, you can kind of dip your toe into the water a little bit, invest in some of those resources, but maybe outsource some of that while you're trying to build your core capabilities and evaluating, which alternative payment model makes sense, which ones don't make sense. But altogether, I would say that it is a couple of years journey in trying to develop those skills and resources that you need to look at the different alternative payment model programs that are out there.
Okay. Let me see. What role do you see CIN, clinically integrated networks, playing in helping organizations pursue a value-centric enterprise? So
I see that as a key component. it's a good contracting vehicle that can allow you to run these value-based care contracts through the clinically integrated network. It allows you to recruit not only employed physicians, but also independent physicians in your community, and to be part of this clinically integrated network. You can pick and choose which value-based care contracts that these physicians are part of, or maybe other physicians are part of. So it's a really good vehicle to allow you to do those things. It also is a legal way that organizations, health systems can look to create the infrastructure and take off some of the costs to the physicians that are part of the CIN by getting them put on a common EHR platform. You legally can find ways to do that through the CIN. There's other kind of initiatives and programs that you can do through a CIN that maybe you can't do through other type of programs. So it is definitely a good vehicle to allow you to evaluate value-based care contracts, to pull in different types of physicians, both employed and independent, even looking at post-acute providers and how they can participate. And then finally, you can also market that clinically integrated network across the region, across the state, where we've seen local CINs of a health system, work with maybe another CIN to create a kind of a regional CIN, or maybe taking your local CIN and working across the state and creating a statewide CIN. So again, it's just a really good vehicle to kind of help further grow kind of your pursuit of value-based care contracts, and to demonstrate, the performance of how well that your health system is doing, from managing cost and looking at improving quality.
Okay, we have another question here. They've extended the bundle payments for Care Improvement Advanced Initiative for another 2 years. What do you think CMS will do after the program ends?
Yeah, I wished I had a crystal ball that could predict that, because we are being asked a lot of those questions. And so just if others are not aware, CMS has extended the current Medicare bundle payment program for 2 more years. So that will go into effect starting in January of 2024, all the way through December of 2025. And so what CMS has been saying in different presentations and also in that market refresh that they did last year was that they were going to be rolling out mandatory bundles starting in 2026. So we're expecting some type of proposed rule that'll come out probably in the spring next year, maybe in the fall, because we feel like there's going to be a comment period. We feel like it's probably going to be focused on some of the surgical clinical episode bundles, so maybe cardiology. Right now we have the oncology EOM, the enhancing oncology model that's out there now. So we think that cardiology is probably going to be the next route they go. But then also orthopedics, CJR, the comprehensive joint program, it's going to be sunsetting at the end of 2024. So could orthopedics be a mandatory bundle that they're going to roll out in 2026? We don't know which way they're going to go. We just know that based on the current administration, what the goals that they've set, that they clearly are looking to create more of these episodic programs, and at this time that they would be more mandatory programs that they would be rolling out.
Great. We're about to run out of time, but I have one final question here for you, Craig. So you talked about organizations needing to have the growth, fluidity, and strategic agility as core capabilities for a value-centric enterprise. What type of strategic plans are you seeing organizations focus on with declining margins and overall reimbursement declining?
Yeah, so good question, and I would say it's kind of all over the board. We're seeing some organizations who are, taking the strategic plan that they had maybe from last year, but then looking at modifying components of that strategic plan. One component might be value-based care. How do we create a separate strategic plan just on value-based care, but it is part of our overall strategic plan. The other thing that we're seeing is because of the constant change in reimbursement, changes that are occurring in CMS, CMMI with different models that are occurring, what's happening in the industry. When I mentioned the non-traditional players with Amazon, CVS, and what they're doing, we're seeing organizations redoing their strategic plan on a yearly basis. So used to, we would say, we need to revise our strategic plan every 5 years, maybe every 3. Now we're saying we've got to re-update our strategic plan every year because there are so many changes that are going on right now that we need to be able to adapt, be nimble as a health system, and make sure that we've got the right focus from a strategic planning standpoint. So, probably the biggest impact I would say is seeing that these plans are moving to more of a yearly, maybe every 2-year process, just because of all the changes that we're seeing across the healthcare landscape.
Great. Thank you so much, Craig. I wanted to let everyone know that Craig has graciously provided us his presentation today, and I'm going to email that to everyone who registered for this event, and I'll send that out today. We also recorded the event, and I'm going to send everyone who registered a link to this webinar tomorrow morning. Craig, do you have any final thoughts?
No, I just appreciate the opportunity to speak to the council, and hope everybody has a good day. And if there's ever anything we can do for you at FORVIS, I'm always happy to help. But thanks, Chris, for helping organize and kicking things off for us.
Thank you, Craig. It was a great presentation. Thank you to all participants, and the webinar is now ending. Thank you.